There are many ways to treat glaucoma. The mainstay of treatment is eye drops. We have a variety of different eye drops that we can use, generally starting off with one drop patients will use at bedtime. Some of the drops that we add to that are twice-a-day drops. If the drops are not controlling the pressure well enough, and if we see changes on a patient's visual field test or on their ocular coherence tomographies, then it tells us that we need to move probably to a laser procedure called SLT, or selective laser trabeculoplasty. It has the same potential of improving the pressure as what a drop does. Typically, we'll see somewhere around a 30% reduction with eye drops or with the SLT laser. Nowadays, it seems like a lot of doctors are moving toward SLT as a first line of treatment rather than eye drops. And a large part of that is due to the cost of eye drops. Myself, I usually get involved with the glaucoma patients when either the drops or the SLT hasn't worked as well as it should. And my job is to try and do a surgical intervention to try and reduce their pressure. The two procedures that I do the most of are your Express Mini Shunt. The Express Mini Shunt is just a real tiny hollow piece of titanium. We make a small partial thickness flap on the white part of the eye up toward the top part of the eye. And underneath that flap, that shunt, part of it will be inside the eye and part of it will be under the flap. And it allows the fluid inside the eye to gently percolate out underneath the conjunctiva. The other procedure that I've been doing is called canaloplasty. With canaloplasty, we're working primarily on the drainage mechanism inside the eye. And we thread a very fine catheter through that drainage mechanism all the way around, 360 degrees all the way around the inside of the eye. And we're dilating that drainage mechanism to allow it to function better. And that lowers the pressure very, very well also.